Do you know that chlamydia is one of the most sexually transmitted infection in the world and that most people that have it do not even realize about it? Hey everyone, I'm Joy. Welcome back to my channel where we talk about real health topics without the stigma or confusion. Today we're breaking down everything you need to know about chlamydia and how you can protect yourself. Let's jump right into it. So what is chlamydia? Chlamydia is a bacterial infection caused by something called Chlamydia trachomatis. It spreads through sexual contact, which includes vagina, anal, or oral sex with a person that already has it. It is super common, especially among people under the age of 25, and the tricky part is that most people do not even have symptoms to show that they actually have this bacteria, which means you can have it, feel totally fine, and still spread it to the next person without even realizing it. Now, there is a good news. The good news is that chlamydia is actually curable in as much as you get tested and treated on time. Now, let's talk about the mode of spread. Chlamydia infection spreads through unprotected sex. That means without condoms or dental dams. Can also be passed from a pregnant mother to their child during childbirth. You can't get chlamydia from things like hugging, sharing of utensils, sitting in public seats, or even using the same toilets. These are common myths, but the infection can only be passed from one person to the other through sexual contact involving bodily fluids. What are the symptoms of chlamydia? Remember, most people do not show symptoms at all. What are the symptoms of chlamydia? Remember that most people do not notice any symptoms at all. So for people with vagina, one of the signs can include unusual vaginal discharge. Sometimes they have burning sensation while peeing, pain during sex, and also lower belly pain. Then for people with penises, the symptoms includes discharge from the penis, burning sensation during urination, pain or swelling in the testicles. And if the infection is in the rectum or throat, there might be pain, discharge, or soreness around those areas too. If any of this sounds familiar and you've had unprotected sex recently, this is the best time for you to go get tested, even if you feel fine. Now, how do we test for chlamydia and the treatment plan for chlamydia? Testing for chlamydia is simple. It is usually done with the use of urine or swab. You can get tested in the clinic, hospitals, or even some pharmacies depending on your location. If you get tested positive, do not panic. Chlamydia is easily treated with the use of antibiotic, which usually lasts for at least a week. But it's super important to finish the entire dose of medication even if you start feeling better right away. And also, your partner should get tested and treated. Otherwise, you might just pass it back and forth. Now, how do you prevent Chlamydia trachomatis? The best way to prevent chlamydia is to practice safe sex, use condoms or dental dam every time. Regular testing is also key, especially if you are sexually active with new or multiple partners. And don't be shy of talking to your partner about regular testing. It isn't awkward, it's responsible. Think of it as part of taking care of your health and that of your partner as well. There are some myths and facts about chlamydia. I would like us to talk about it. Number one myth is that people think that only those that sleeps around can get chlamydia. But the fact about this is that in as much as you are sexually active, you are prone to having chlamydia. Number two myth is that you can tell if someone has chlamydia by looking at them. But the fact is that chlamydia has no symptoms, or some people show no symptoms. The third myth is that people think that once you've gotten treated, you are now immune to it. But the fact is that unfortunately, you can get chlamydia again after treatment in as much as you are re-exposed to this bacteria. So that's everything you need to know about chlamydia, what it is, how it spreads, and how you can stay safe. If you find this video helpful, please give it a thumb up, subscribe, and share to someone who might find this information useful. And remember, getting tested isn't embarrassing, it's empowering. Take care of your body, and I will see you on our next video. Bye.